Welcome friends, welcome viewers on your favorite source of learning, MuniMeterHealth. We are here educating our medical community as well as the patient community, primarily to enhance our goal, which is improve the clinical outcomes. So without any further ado, let's delve into the short series which we are conducting right now. I'm Dr. Jaitly from New York, your cardiologist. Today we're going to be talking about broken heart syndrome. Believe me, it's not a Hollywood term. This is a medical literature, even though I've shown this as a schematic. Broken heart syndrome, which is also called as BHS, and in future we're going to use this as a terminology. BHS results from an acute or an abrupt onset of a physical or an emotional stress. It could be a financial stress as well, where the person actually suffers abruptly and manifests itself into as a heart failure, which is congestive heart failure, or as a heart attack like symptoms, which is like myocardial infarction or MI. Now, why does it occur? It occurs because there's a surge of certain hormones which are released either from the brain and or from the adrenals. And you know very well these are your fight and flight hormones. Typically the catecholamines, we call them, or the adrenalines. So once the adrenalines reach the heart, that's where the stunning occurs. We call it the stunning of the heart. And the heart gets stunned in a way that, you know, the heart is a four-chambered organ, and obviously the left ventricle is the most important chamber. And being here, the left ventricle, this suffers, and as a result, the contractions which are normally occurring in the left ventricle to boost the blood through the aorta up into the aorta, that suffers. So as a result, all of this is not happening so vigorously, and normally the ejection fraction, which is about 55% and above, that means the amount of blood that it normally ejects is about 55% from within the volume of this left ventricle. That goes down precipitously in broken heart syndrome, and it results into a heart failure or a heart attack like symptoms. Now, ECG will be helpful in that regard because it'll show the signs of myocardial infarction or heart attack, as we call them, by virtue of showing ST elevations. Again, for the medical community, this is helpful, I guess. And echo, of course, will reveal the weakening of the heart muscle. Now, we know the heart muscle is very, very crucial for us. So let's draw a schematic here. Now, this is the left ventricle I'm only drawing. Obviously, it has a wall, not a brick wall. It has a muscular wall, as we call it. And that muscular wall, this muscular wall, as I drew here, gets weaker in certain portions of the ventricle. Now, chiefly it gets weak here. It gets weak here and gets weak here and here. So basically, this is your base and this is your apex. So there is basal ballooning and apical ballooning, because the heart is now contracting only where? It's only contracting mostly in the middle of the left ventricle. Where is the left ventricle? Right here. This is your left ventricle. So basically what I've drawn is this left ventricle in here as a magnified way. Now, what results as a result? So the broken heart syndrome will result into something like this, if you will. If you were to draw the same thing and show, it'll appear like a hourglass left ventricle. So this left ventricle becomes like this. Why? Because these are the central walls of the left ventricle which are contracting, whereas these are not contracting, so they dilate, and as a result there is a ballooning, and it becomes like an hourglass type of deformity, which is commonly seen on an echo. So just so that you know, on an echo it'll appear like an hourglass. You know what an hourglass is? An hourglass type of deformity can occur. It can also be seen on a cardiac MR. We call it CMR. The same thing will be seen here. And if you were to look at the coronary angiography, or cath, we call it, if you were to do a cath, the coronaries will be normal. So it'll have a normal coronaries, but obviously the ventricle will show a classic left ventricle left ventricular dilatation, if you will, and mostly it'll be in this area, the apical area, just so that you know. So all of that will be dilated here. So in a nutshell, broken heart syndrome is a clinical entity that results classically from an acute stress, whether it's financial. You may have somebody may have lost millions of dollars abruptly in business or otherwise. There might have been a bereavement as a result of some spousal demise, or a child or a loved one in the family, very close, somebody suddenly dies or becomes critically ill, gets admitted, or gets diagnosed by cancer or life-threatening illness, or a motor vehicle accident somebody has suffered into, and the other person now suffers a broken heart syndrome. So these are classic examples that I've seen in 40 years in my life, where I can cite these examples. Sometimes it could be just a separation from your loved one. It could be a breakup in a long-standing relationship, and suddenly there's a breakup there. So that could also result into a broken heart syndrome. Now remember, the broken heart syndrome is a temporary. Fortunately, it's very temporary, and the heart function normally returns back, and it takes days or weeks, but you have to treat it just like you'll treat the heart failure. You will treat with ACE inhibitors, and you will treat with beta blockers, and then you'll also treat them with diuretics. So in any case, all of this will be encompassed as a treatment profile for all our patients who are diagnosed by broken heart syndrome. Remember, it's the heart stunning that occurs from the adrenaline, which is pouring in either from the brain and from the adrenals, and as a result the stunning occurs rather precipitously, and as a result the heart muscle gets weak rather quickly and very abruptly. So broken heart syndrome, it has other terms as well, just to confuse you a little more. It's called stress-induced cardiomyopathy, or it's called tako-tsubo, and I'll just write it down quickly. tako-tsubo, S-U-B-O. So this is tako-tsubo or TTC, tako-tsubo cardiomyopathy. So broken heart syndrome, stress-induced cardiomyopathy, and tako-tsubo cardiomyopathy, they are identical and they are synonymous. Okay, well, looking forward to talk to you again in these clinical topics that we pick of interest for you, and mainly as part of our short series that we're doing on MuniMeter Health. So thank you again for staying on MuniMeter Health. Stay healthy now.